So we're here right now with Vanessa and Tigran from Public Health Seattle in King County. What's happening?
Hi.
Hey,
How are
how's it
you
going?
guys today?
Good. How are you?
Good.
Yeah, I'm all right. You know what I'm saying? It's like, COVID-19 has made everybody Zoom superstars. You know what I'm saying?
Or
Uh,
trying to be.
Sure.
but I gotta give the county, definitely some credit because, it's always been a lot of efforts or the health department at least, to be able to get information out to the community. And I really like the fact that you guys are joining us today, because information about COVID can almost be like drinking out of a water fountain. I mean, there's actually so many people that are doing such a good job to get the information out there that sometimes we have to be able to step to the side and take a bite size, chunks of information, especially because a lot of people that are tuning in to our show, we got a lot of elders and community members, and sometimes the way that information is given to the public these days could be a bit overwhelming.
Yeah.
So I'm thankful for you guys joining us. Maybe you can tell us, like, right now, what's going on with COVID in King County. I know it changes by the day, so we'll throw that caveat out there. But what's happening? Where are we at?
Yeah. Right now, we're seeing a rise in cases of COVID in King County, and part of that has been due to multiple factors that we're still trying to nail down. Part of it is because of things reopening. Part of it is because people are traveling more. And we're really trying to figure out what are the reasons why transmission is increasing, and what's happening in our communities and what we can do to help. Fortunately, we haven't seen a big rise in hospitalizations or deaths at the same time. That's not to say that it's not something that we're concerned about, because we could see a rise. It might just be a little bit delayed behind the rise in cases that we've seen. So we're just, at this point, we're trying to keep track of this increase. We're trying to get more tests out to people. And yeah.
Man, so basically, COVID's on the rise.
Unfortunately.
Yeah, unfortunately.
And so what you guys are saying, though, is what you're trying to figure out is if it's community spread, or if it's like, new people in, or why don't you, if somebody could take this one, can you explain? I think a lot of people know, but just want to cover the base when you talk about like community spread, and what does that look like in an everyday person who's, maybe could be a community mass spreader, but don't realize it.
So I can take that, and then Tigran, you can add on. So what we mean by community spread is typically that we don't know where that transmission is coming from, right? So if we think about the fact that in the long-term care facilities, and that's where COVID-19 broke out, you were able to track where somebody got it. It was at their long-term care facility, whether it be residents or staff. When we say community spread, it's somebody who's been tested positive for COVID-19, but there's not a clear direction as to where that happened. So that could have happened in a grocery store, right? That could have happened when somebody was walking by somebody. It's just the connection there isn't as clear, which is why we're always saying in public health, if you can't keep 6 feet away, wear a mask, try to keep socially distanced, because sometimes it's harder to understand where exactly that point of transmission takes place.
It says, could you explain the R factor? What is the R factor?
Yeah, so the R effective number, or the R factor, or sometimes it's called R naught, is a way to track how much transmission is happening in our community. So what that number actually means is the number of new cases we'd expect to see per each current case of COVID. So if I had COVID-19 and the R factor was 1, I would be expected to transmit to 1 person. If it was 2, I would be transmitting to 2 people, and then so on from there. So we want to get the R effective below 1, because that would mean we're actually reducing transmission. So for every case, there's less than 1 person who's infected. And that would mean transmission's going down. So right now, I think our R effective is somewhere around 1.3, which is above 1. So we're actually seeing an increase in cases rather than a decrease.
Now, we've heard a lot of talk nationally about the disproportionality in regards to death from COVID-19. And, I mean, what we're seeing is that in a lot of parts of the country, it's really the people who are on the front line, and a lot of times are Black and brown people of color, that are actually dying from COVID. And, we hear that it's, predisposition of, health and everything else. Can somebody talk about, it seems like to me it's two different things, but they all kind of might end up in death. Is that one, that you have Black people of color who are out there, in essential capacity, and whether it's in the urban areas or even like in Yakima County, who are the ones that are catching COVID. But then also, how does any pre-existing health conditions and possible lack to high level health care also add into the numbers of fatalities that we're seeing for COVID-19 amongst Black people and people of color?
Yeah, so I think you're bringing up two really good points, and I'll just speak to those broader issues, and then Tigran piggybacking off. I think this might be the moment where we show the disparities dashboard as a way to just kind of navigate that. So I think what you're saying, Omari, is very much for me and how I understand COVID-19. COVID-19, it is a new disease or virus, but it is definitely a manifestation of already existing health inequities that we've seen, right? If we think about the fact that there's certain conditions that make folks more vulnerable to serious death as it relates to COVID-19, those tend to be concentrated in communities of color. And when we think about the fact that initially when we started this, it was just everybody stay home, certain communities haven't been able to stay home. So if you tack on the pre-existing conditions on top of the fact that these communities haven't really had the chance to isolate in the same way, those two things just kind of create just a really problematic space for communities of color who are constantly on the ground having to do the work and having to go outside.
All right, so maybe one of you guys can tell us then, what data can help us decide what is the safest action for ourselves and our family?
So I think keeping track of what's going on in the community is kind of the best way to make decisions about how much you're putting yourself at risk and what actions you should be taking. So on our website, kingcounty.gov/COVID, there's several data tools and dashboards that you can go through. But I think the kind of most, the one that kind of summarizes everything at a higher level is our daily summary dashboard, which is a way to track what's going on right now, what areas are seeing higher rates of COVID, what areas are seeing kind of higher rates of testing or lower rates of testing, and to get a really quick snapshot of what's happening right now. And I think knowing what's happening around you is one way to make informed decisions about what you should be doing and what actions you could be taking. If cases are really high, that might be a sign for you to maybe stay home or take more precautions or try to physical distance more. Whereas when cases are very low, you might be more comfortable going outdoors or having picnics or, taking more of a harm reduction approach of I can do these things now because cases are lower.
What rules are in place in King County in regards to masks and everything else? And is a mask here mandated? We know that Governor Inslee had mandated the mask in Yakima County. What's the story here in King County for regular citizen and for business owners, people who might be on public transport, things like that?
Right now, we do have a mask mandate in King County, and I mean, regardless of the mandate, it is a good idea to wear a mask when you're in indoors or in a public space or even in a crowded outdoor area. It is a way to protect yourself from exposure to COVID-19 and to protect others. So it's generally a pretty good idea to be wearing one.
And I know that King County is definitely, I know that there's a mandate, but I know that there's been conversations at King County understanding that there's certain communities that can't wear a mask, whether it be disabilities or pre-existing conditions, but also recognizing the different repercussions for different communities wearing masks, right? If we think about there are certain communities that when they wear a mask, that becomes something that other folks react to differently or are problematized. So while King County, we recognize the role that masks play in preventing the spread of COVID-19. We are also in tune to some of the reasons communities and certain groups might not be able to use a mask in the same way.
So, I mean, are these masks making a difference?
I want to say yes, but I can just give you an example to show like why we're thinking it's one of the reasons why. If we think about the protests, right? One of the biggest worries was that like folks in the streets, being in the streets together in these large spaces, that might be one of the ways that COVID-19 transmits. But what we're finding actually is that there was a really small rate of transmission in the protests. And part of that we can attribute to the fact that like a lot of people were wearing masks during the protests, washing their hands and doing like hand sanitizing. So that's like an anecdotal example of why it's suggesting that masks actually work.
So maybe you guys can refresh us because COVID's been out for a while. Maybe people might forget about some of the symptoms, some of the telltale signs, or when people should get tested. So maybe you guys can go over like, hey, you know what, I'm feeling this kind of way. Maybe I should get a test, or when should people get tested, if at all?
So I think the kind of main symptoms that people will think about when they think of COVID-19 is fever, cough, and difficulty breathing or shortness of breath. And those are kind of like the main ones that we've been focusing on. In addition to those, there's a slew of other symptoms that may indicate that you have a COVID infection, such as like loss of smell or loss of taste, diarrhea, vomiting, nausea. So these are kind of the signs, but those first three are kind of the primary ones that I think have been like the most common that we've been seeing, and the ones that we've been kind of telling people to look out for primarily.
What are some of the things people should be doing and thinking about when they get tested?
Yeah, so that brings up a really good point. I mean, the most contagious period for COVID is actually before you're actually showing symptoms. You know, you could be contagious for like 2 to 14 days before you show any symptoms, and you know it's important to recognize that as a factor in deciding to get tested. So we do recommend getting tested if you are in contact with someone who might have symptoms of COVID or who you know is positive for COVID, or if you're in a situation where you know there's like a high chance of exposure to someone who had COVID.
The big thing that we hear about is that people that health officials like yourselves and state governments, they want funding for contact tracing.
So contact tracing sounds like a scary term, and I know in the media it's been like portrayed in kind of a scary way, but we've been doing contact tracing for decades in public health. It's kind of our number one way of preventing new infection and preventing the spread of disease. So what contact tracing is if someone tests positive for COVID-19, what we want to do is we want to follow up with people who have come into contact with them to see if they're also positive for COVID-19, but also to ensure that they have the resources to like get testing, to like protect themselves, to like isolate if they need to, and to basically like trace the route of transmission, and potentially identify a source where like people are getting exposed, so that we can kind of make sure that we're like kind of cutting off that route of transmission.
What do you want the general public to know about, you know, where we're at with COVID, next steps, and what they should be doing?
So I think if I were to sum it up, like we're not done, right? This is a long haul, and we want to make sure that we are taking all the necessary precautions to take care of yourself, but as well as like your loved ones and the vulnerable population. So if you must go outside, I know we talked about masks, but have your mask, try to stay 6 feet, engage outdoors. Like it's beautiful outside now, right? So if we can make sure that we just stay in like outdoor spaces, that's better than like confining yourselves inside, and just like try to listen to like the additional public health precautions. For more information, and this is something that we always have to do, visit kingcounty.gov/COVID-19, where you can get a lot more information on like safety data, as well as other information surrounding COVID-19.
Yeah, and also check out our blog, Public Health Insider. You can sign up for it at publichealthinsider.com. And if you have medical or mental health concerns, you can call our call center. They're open from 8 to 7 p.m. At 206-477-3977. Or if you need immediate resources, you can call 211.
People should realize though, and I mean, especially people of color, but all people should realize that, man, the COVID is, man, it's no joke. It's out here, whether people feel like, oh, this is, some super killer disease, or people feel like, oh, it's just another flu, or whatever people's feelings are, and even people's political leanings. I think that whatever we can do as individual stakeholders in our city and our county to just keep the next guy safe.
Yeah.
You know what I'm saying? So whether you think that it's, it's over here, over there, COVID's the most politicized disease probably ever in the history of mankind. And so I would just say, whatever someone's political leanings, if we're able to just keep our neighbors and our friends and coworkers safe, then I think that, that's a good place to start.
Definitely.
Definitely.
See, you wrapped it up perfectly.
Mm-hmm.
I guess that's your job, though.
Do.